We are now recording.
Good morning, thank you all for attending. Early winter mornings. Hope you all had a great Thanksgiving. And we're pretty, and now we're back. Back to work. So, first item on the agenda is the approval of the November 2nd minutes. Any questions, corrections? Motion to approve, please. Second. All in favor? Opposed? Nay. And thank you, Alyssa, for being minutes again. Reports, Health Department.
Jen Ileson, Director of Health. So we continue with vaccinations and flu. Obviously, we have more than COVID. COVID's been very, very low uptick. And just a reminder, we only have the 0 to 18 because that's the program we're in for COVID. Flu is all ages. And at the bottom, I show all the charts and the latest data of COVID, RSV, and flu, which is very interesting to see the case data. And particularly with RSV, including the RSV has had, the 5 deaths. So I think it puts into perspective, of what's circulating and some of this, you can get vaccinated and immunized against. Environmental health, we're still motoring along in OpenGov. We are doing relicensing for the restaurants, and we've received 55 out of 99 so far. They have to December 31st. So far, so good in OpenGov. We've only had 2 or 3 that we've had to actually help and, say, send us your stuff, we'll attach it for you kind of thing, but so far so good with that. That grant, we just met on Tuesday at the Bridgeport EOC, the regional health directors for volunteer reception center plan, not to be confused with the family assistance plan that Bethany had talked about in the past. The volunteer reception center plan is for any major event, kind of like a 9/11 or any kind of mass shooting or anything like that, where people begin to self-deploy. The Newtown Health Director told us a lot about this, where people just like show up, including first responders, and like self-deploy, and it kind of becomes chaos. So what this is for, the intent of it in the region is that's where the volunteers would go to. And then they would then be assigned jobs of where they are needed and also vetted to make sure that, either they're associated or with an association. If they're not with an association, like Red Cross or whatever, then, we get the paperwork that we need to vet them. Because like Fairfield had mentioned in the past, when people self-deployed during Sandy and Irene, those, good Samaritans, you get some bad apples in that bunch. And they ended up with a lot of issues. So the point of that is, to kind of prevent all that, keep everything organized. The next step of this is in March, we'll be doing a tabletop exercise in Norwalk. And then in April, a full-scale exercise in Darien, and bringing in the CERT teams, the Medical Reserve Corps, and all these volunteer groups, run through it. Because unfortunately, in this day and age, you just never know when any of these types of events are going to happen. Community health updates. Shannon is now a certified lead inspector and certified lead inspector risk assessor. So I'm happy to have her assisting with
Shannon has new certifications every month.
Yeah, well, unfortunately, in public health, there is a laundry list and it takes years to get everything.
It's great.
So the 2 QPR trainings we had in November, both during the day, and then there was one also at night, were both full with long waiting lists, which was great news. We're kind of having issues with the library getting space because there were so many groups competing for space. So in an email that Russ had sent about an article about suicide, Lauren Patterson from Community Foundation and Waveney have offered to help us, with space and refreshments and everything. So I'm going to circle back to her on that. I also reached out to Grace Farms to see if we can get space because clearly there's demand, which is great. The problem with the QPR is we can't exceed 20, because they don't want you, trying to do 100, it kind of loses the focus of it. So, hopefully we can nail down some dates for January, because this is the key time of year too for this. The blood sugar screenings are still going. The Q&A health topics that we do every Friday are still going on at Lapham. In January, Staying Put has offered to sponsor one with a luncheon in the big dining room for, with hydration being the topic, because that was a big hit when we did it earlier in the fall. And that will be actually on January 12th. So thank you to Staying Put. It's great to have these organizations, helping us out with these programs. If you go to the charts from the FE surveillance, again, you'll see the suicide ideation, which is another part of the email chain we were talking about. The 10 to 34 range is really our group there. And then the opioids, that's, kind of leveled off. There really wasn't much going on in November, just good news. We kind of like to see it that way. So we'll see where it goes from there, but the suicide ideation, and the QPR stuff, I think is very important. It's just another tool in the toolbox. You have the urgent assessment, you have other things, but the more you get people to talk about it, recognize, kind of warning signs, I think the better. And the partnerships with nonprofits to assist us in sponsoring this stuff is also, we are very grateful for the support. So thank you, Rox.
FYI, this, we have a pandemic infrastructure now in the federal government. So that grouping was disappeared at the change of administrations. So they now have an office of pandemic policy and response policy and what have you. So I think it's a good thing. And they are teaming up with HHS in terms of ongoing testing, improving the testing, drugs, and vaccines. So, because that's
Well, hopefully we
good to
don't
have
have
in place, and hopefully,
hopefully we don't end up with it like an Ebola kind of pandemic.
Right.
But then I'm out. I draw the line at swabbing those.
She does have her limits. We found one.
it's not the gear up for
Oh,
human services.
All right, Bethany Zorro, Director of Human Services, starting out the budget season. Getting the PowerPoint ready for that. I'll show you all when I think January is the first date that we'll get on the board, get on the project. Holiday, our PSA, Public Service Announcement campaigns are running for the New Canaanite and the Advertiser from now until New Year's Day or New Year's Eve.
It's good to see them.
Yeah, so those are in the two. I reached out to the Sentinel, but did not hear back, so I don't know what happened. Anyway, the Choices Counseling ended yesterday for the Part B program for the drug. So Marcy and I did a lot of troubleshooting, and I think everybody is all set. We'll see what happens, January 1st. Opioid settlement remediation request, the Board of Selectmen did pass the proposals that you all had a motion to accept, so that we're in the process of the 4 agencies coming forward and making whatever their programs were. They don't have to do them right away, but right now we're working with REAL, which is the parent education or educating someone who is dealing with someone that has an addiction issue. And so we're getting that legally set up so the town is not liable. But this is all to help understand it. It is an educational website. There's nothing medical about it.
Yeah,
And so,
we'll discuss that too. The greater land under board business.
yeah. So we're in the process of emailing back and forth and setting up so everything is good. Bereavement partnering, working with Waveney on having a bereavement group launching in January. Thank you, Russ. And our food drive, St. A's was incredible. They hit an ultimate 418 bags this year. South School, Playland Nursery School, we had a donation anonymous $10,000, which we do, for the past 2 or 3 years.
Oh, nice.
So the same donor 3 years in a row?
It
Say,
appears to
an
be,
adopt anonymous donor 3 as well.
it appears to be, yeah. So not that we expect it every year, but we're grateful every year we get it. The poll speaker, we have Jill Winter coming today from the Family Centers, Center for Hope. And November meetings, you can just see through the, with Silver Hill, Buchanan Abuse Prevention, Small Town Directors, Get About, Community Foundation, which is starting up, looking into behavioral health in the older population,
Mhm.
looking into that.
Everybody need it.
Big question, remind me what the nuance rounds that,
Marcy does.
Marcy did.
Okay, and then urgent assessment program, we're giving, that's gonna be next week now, but we're going to be meeting with Deanna, and Silver Hill, they're coming here, and we're just going to get her up to date on what's happening, and, referrals for me, people just calling, in our continued blood pressure clinics at Schoolhouse and Lapham, those are very popular, and it's a good time to touch base and just do a quick assessment on how everybody's doing. Marcy, once again, her caseload has increased to over 200 adults and seniors now. She continues to take on, we have a new adult protective service, case. These are lengthy and they're hands-on. And you get a lot of family dynamics happening. And phone calls, so we definitely, she's sensitive to each side at the same time. Most often, the adult child is from out of town, so it's tricky.
You don't have any.
It's tricky, so she spends a lot of time with that. The nuance rounds, every Wednesday morning, it is a group, it's a really social working in terms of what the social workers at Nuance are seeing for discharge planning, for situations that are coming in. And they also help very much with some of the issues that Marcy comes in touch with, because there's a lot of referrals back to us when someone is discharged from Nuance, from Norwalk Hospital, needing more care, home care. And so it's very hands-on and a lot of feedback from social workers and home care agencies, what they're seeing and how they can,
But it's focused on Norwalk, not the general Nuance catchment area.
it is the catchment area, but Marcy mainly focuses on, she hears about and is involved with some of the cases that get pushed, passed on to her for continued care. And, it's a fine line, being a municipality and giving someone personal care, there's a fine line, but we need to step back and, decisions are made, but we can only offer resources and, what guidelines of what people in the area have done and clear resources that have provided with a positive feedback from these resources. It's very fine line.
It's Nuance, but that would be Norwalk, catchment area, which would be Norwalk, Buchanan, plus or minus Darien, Wilton, and Westport.
Yeah, but we do get feedback from other, as Nuance is in other counties and areas, agencies, but we do get feedback and Marcy hears what's going on in other areas. It's very, compatible. What everybody's seeing very much the same thing in their regions.
Does Stanford Hospital have something comparable?
Not that we know of. And
Not that I know.
yeah, we've tried, for some reason, Nuance, it's been an easier communication base for us. They're very interested in working with us. We have reached out to Stanford Hospital. They might have a different model. I don't know, but we're there. If someone needs to get a hold of us, and we have called, discharge planners and things they tend to work with, I don't know. But Nuvance is very much a partner of social worker. And so, yeah, it's excellent. It really helps us and it helps the resident. So, and then Jackie's caseload is now, you know, she has over 200 kids. And
Are they busier, or Jackie and Marcy more up to their eyeballs with work than they might have been?
I'll tell you, there is, as long as we have this partnering and communication within other agencies and things like that, they're handling the increase in caseloads because it's so effective, our communication with these other organizations. And, yes, they're busy, but they can take on more. Their efficiency and what we've created is excellent. But we have social workers coming from agencies to New Canaan, so that it's incredible. But yes, as you can see, the food pantry itself has doubled since January. That it's a combination of, as I said, Canaan Parish having the extra.
Are those record numbers?
Record numbers, yeah. Canaan Parish has, you know, the affordable housing has brought in people that qualify for these programs. And as a result of Tuesday's distribution, and we were not even handing out the gift cards for the dinner, for the holiday dinner, we had 40 families come. It's never been this high, but our clientele is very appropriate. It's proportional to the clientele. Our clientele is increasing, the needs are increasing. What we have to look at is the food pantry itself. We are running out of space. And so Enza, who's a coordinator, is talking to St. Mark's to see if we can utilize another portion of the area downstairs, just for, it's a safety issue with grocery baskets that we have. People getting their groceries and things like that. We have to keep a safe atmosphere, especially for the seniors. So we need a little more organization in terms of, I don't want to say crowd control, but traffic flow. And we just might have to, we're spending a lot more money per distribution day. And I just very grateful for the community. If we need more assistance in terms of volunteers or items or finances, I know everybody's there to help. So that is what's creating with we can handle the higher client rate, but in terms of the actual physical on-site food pantry, that is expanding. So we're keeping a close eye on that.
Bethany, do you know, roughly year over year, the increase in Marcy and Jackie's caseloads?
Yeah, I have that completely spreadsheet month by month, and you can see the incremental. We go back to, I think, 2020, 2019. So yeah, I'll send that.
Thank you. I mean, do you know roughly though, has it doubled like the food pantry, or is it up like 20%?
I would say, looking at the caseload, Marcy, who has 200 adults and seniors now, at one point it was 160, 170. And then Jackie, I mean, she used to have like 110, 120 adults with about 160 youths at one point, and it's slowly, incrementally has gone up, and it's got, definitely with the economy, a number of variables.
Yeah.
But they're all ultimately giving a greater increase in clientele.
How much of it is due to greater awareness that we're here and greater customer satisfaction?
Yeah. And greater partnering with these other agencies, and Chuck, I think so. I mean, Marcy and Jackie, as well as Enzo, working with the volunteers in the food pantry. It is a wonderful, it's a wonderful camaraderie, and we want to keep it that way. People want the human services, and we want them to feel welcomed.
Well, we think about the new housing units that come on in Caney Parish, I mean, that probably had an input. I had one question that, on the referral section, we had 10 including housing. You know, what kind of housing needs, just 1-bedroom rentals, or they're looking for affordable housing, what are they
Yeah,
looking for?
they start out, they're looking for affordable housing, low-income housing,
Okay,
and it's a combination, each case. It could be, senior wanting to sell their home and going into affordable housing. Now they're looking at their retirement plan
right,
and realizing, I can't keep this house.
right,
Or adult children have parents coming into town. We also have, divorce situations where, you know, parent needs to move out with the children, the house is in foreclosure. There's just,
but these 10 are actually Canaanites requesting, they're not from outside looking for housing in
Uh,
Canaan.
these are 10 calls. I don't include the outside of the.
Got it, all right.
These are residents
These are people in New Canaan that need housing,
that need housing,
right?
or their parent needs housing. It's a client, it's somebody living in New Canaan, needing something. We have many people call each month saying, I'm looking, or do you have affordable or low-income housing available? I live, you know, I want to, whatever,
Sure, or they're renting somewhere and.
yeah, that's not.
The
included.
house, I was just thinking about, you know, with the housing market being what it is right now, I think if interest rates improve, you're gonna see more houses come on the market. Maybe that's going to kick people out that are in a rental property, but because, you know, interest rates were at 7%, people weren't
Yeah.
looking to sell at the time. Maybe, you know, maybe that's going to have an impact as well.
Yeah, I think every little variable.
Sorry,
Yeah, go ahead.
no, I was just on that same vein, at one point you said that at Canaan Parish, there were some units that weren't being used yet, being rented, is that still
So,
the case?
right, but what happens is then they go to Department of Social Services, might come in saying they have a DV case
Mhm.
in Rhode Island, which we had one, come in, a DV case, and they turned it into a low-income housing quickly for the safety of the person. So then that person comes in with 3 kids. And we want to get them set up, we need to get them in school. And keep the kids as stable as possible.
Is Enza still a part-time person? And I'm wondering, because that job is more than an admin job.
Right, so as this, yeah, so right now she is Monday through Thursday from 7:30 to noon.
So it is.
So-
Is that the way the budget's gonna reflect it for your staffing for next year?
No, it is a full-time position that we can extract the hours that she's working other places. Yeah, it's a setup that we can flow.
So she's working other places within the town.
But that's a job that most people don't appreciate because she's actually processing a lot of those oil applications and whatnot and takes. a lot
So,
of-
well, no, the caseworkers, we've switched so that the caseworkers process all the applications now.
But if the caseworker load is going up, eventually you lose
Yeah.
that leverage. that
So we're
she-
still able to shift around, we're shifting and accommodating just fine, but yeah,
Okay.
you're looking ahead appropriately. So thank you, thank you.
Daphne, I should know this, but no, child first, what is that?
The child first, it is a state, where did Jackie put that down? Yeah.
Sunday.
It is for the welfare of a child. It could be a number of things. It could be in terms of, some type of therapy. See, physical or,
So it's data line supported.
yes, yeah. And it is about, having the child initially be assessed for its needs, because there might be a question of something going on. And so this way the state, the assessments are done, as well as the needs of the child and the family, the situation, and if definitely if help is needed in a lot of areas, depending on the child.
The other thing is, I don't know how many of you read Jackie's monthly announcements. Do you?
Yes.
Because it's lengthy.
Yeah.
It's 10 pages and I wonder how many people like hang in there to go through the whole process of that. And should there be a more concise way of letting people be aware of what's happening in town? Has
So much
any of you
going
felt
There's so much going on. I mean, it's just one of the places that you can look.
Maybe a table of organization on a hotkey that then takes you to the section or something.
Well, we do have that on the website in terms of each link. And that newsletter is on the website, so you can, and it's link friendly.
You think it's fine the way it is?
Yeah, I don't know how much further we can go. Okay. What else? Child first, also it's the welfare of the child that completes the whole, and it could be a situation, a living situation. Department of Children and Families might get involved. So yeah, we don't like to see that, but if we have to, she's mandated and we'll take the process to where it needs to go. So we do have the urgent assessment program, which I sent you the statistics. We had 10 cases in the month of November, and you can see the data that was compiled. And things are really basically the same in terms of the referral sources, mainly coming from the schools, the school system, and other community organizations or residents.
Bethany, do we think that the 10 a month is kind of a plateau level, that's?
Yeah, well, we're waiting for Silver Hill. I'm waiting for this data that they're definitely improving upon now that they have more and more data. So we can see what the trajectory has been and the projections can be based on that. But it seems as if we've had anywhere from, I think, 8 cases to 19 cases in 1 month. And that's the reason, Weston has joined us, and we will be meeting with the steering committee again next month.
I would comment, in that there are a number of people that are watching around the state, the urban assessment program up in Canaan, Newtown being one of them, as we all know, but they've approached Demas looking for a version thereof. I'm having a meeting next week with a major service provider in New Haven who's tied in with Yale, and they're looking. They've always solved these problems ad hoc, but urgent assessment gives you a structure and a professional thing, and particularly the follow-up aspects, which leads me to this question: of the depression and anxiety that are being diagnosed, are those people sent on to local providers that are affordable? What's the process there that takes place?
For the assessment,
Yeah, after you're on assessment.
yeah, so that assessment also involves the capability of the family or the person to continue what is being suggested. So yes, there are, then when you see in terms of what is paid or not paid, we have to find the resources, or Silver Hill starts looking for the resources. They call us, so to tap in on anywhere we possibly can be in terms of offering it to the person. We don't want the reason that they deny further help is because it's not there. It's that to us is unforgivable.
So we can in good faith say that there's a spectrum of suppliers
Yes,
that you can go to for follow-up at this spectrum of
yes,
affordability, which is a
Absolutely.
big deal.
it's a huge deal. Yeah,
Well,
I know all too well.
I think that's the next part of the analysis, right? I mean, this is great data in terms of input and diagnosis. It'd be nice to know what the outcomes is, the outcomes that refer as a.
So the
X
follow-up,
number of, X
Yeah.
number of families can't afford what's being recommended. It'd be nice to
did they
know what
run
the,
out? Right.
yeah, what's the next set, or 2 or 3 visits were seen and they've been assigned to someone. It'd be nice to know on the back end,
So Silver Hill is going to be doing, or they might have started, we'll find out, a follow-up at a couple of different intervals to see what the compliance rate is or the reason that someone fell off.
Well, it's no surprise McCann is not unique in the mental health
Yeah,
situation, particularly for youth. And so everybody is looking for options, and particularly those that serve low-income families.
Yeah.
Because
Is that private paid therapy, so it's.
so expensive, and what we don't wanna see is
Yeah.
someone that stopped, someone stopped getting help because of a financial issue or,
Well, there's medication compliance, there's
There's a
visit
lot of
compliance,
different-
I mean, if you talk to police officers and you're going and someone stopped taking their meds, right? And then once the meds got out of their fat cells, and all of a sudden they're acting out, so it would be interesting to see the back inside.
Yeah.
They're putting it.
we'd like to see.
Yeah, Dr. Gerber presented the other day and, they are seeing the numbers kind of flatten out at these levels, and like us, they think that there's still pockets of the population which are being underserved, elderly being the most obvious, and they're also doing, compliance and follow-up work.
Depression, anxiety.
You know, there's they've done a survey of folks over the last few months and seeing like how quickly were people able to get appointments? How quickly, was referral made? How quickly was that next appointment made?
Yeah, that's what we wanna look at, to see, because great, they come and they get this initial help, but there's also that mentality of once someone does find out, oh, okay, well, I can deal with that. Or I wanna, and then that's their choice. It's someone's free will to receive help or not. We don't want their reason of not getting help was because they couldn't afford it or it wasn't accessible in a timely manner. Everything, we want it to be their choice if they choose not to, but it's not because there was a lack of resources in some aspect. And that's what we need to see in terms of the compliance rates and why.
And what they've seen so far is the process is working pretty well, but to Russ's point, like the actual outcomes are not really known. Because
Yeah.
they articulated, because I asked them, I said, hey, what role were you really trying to play in the ecosystem? And they said, honestly, it's navigation. For extreme cases, this is a place you can go. And no questions asked, and start to get referred out. They feel that that's working, but to your point, this is events the providers and it's compliance and stuff like that.
Yeah, once it gets out of Silver Hill's hands and it's placed in someone else's hands, I mean, yeah, the variables increase in terms of, positive outcomes, how positive.
They have that data, and it just hasn't been reported, or?
They're deciding on the data. I feel like they're,
I think they're doing two things. One is they've done a survey of people who've gone through, but only people who've gone through since the beginning of October.
Yeah.
So that's like 16 folks, and they've only gotten 50% response rate, so they've got data on 8. And it looks good, but they're early days on it, but they're being smart.
They're
They're
being
starting to dig into data and learning from it, and but they're, they'd love to see more. I mean, the weird statement, they'd love to see more volume because they know.
usage of the program.
Because the issues
Yeah,
are out
that's
there.
the best way.
Yeah, the issues are out there and
100%.
it's not being accessed.
Exactly, yeah. So, and I know Silver Hill's doing an incredible job of getting out there. We certainly have, things going on and they dropped off our mental health programs at the churches and things like that. I think everybody's doing a good job, and always open to more access to.
Yeah, and there was a shout out to you and HHS as well, in terms of how valuable all the work you guys are doing is too, just.
Yeah, we love it.
So that probably answers Tom's question.
Is that okay?
But I'm gonna add to it, so urgent assessment, they have a meeting, behavioral health urgent assessment every 2 to 3 months. And large numbers are invited from every field. It turns out to be, it's a marketing meeting, essentially, more of that than anything clinical.
I agree.
The numbers have been not disappointing, but as Dr. Gerber said, they plateaued, where we're getting 2 to 3 per week. And, it was like that almost from the start. So we haven't seen any real growth. It's still great to have it there, but financially, et cetera, moving forward, TBD. Are there Deanna Carlson or Dr. Gerber. Not that he misrepresented me, but he said that he gave her the impression that they were fine with their numbers. And she wanted to know, well, why doesn't, if they're fine with their numbers, why don't we just keep it at New Canaan as opposed to Wilton attempting a Darien, which is not coming, and Ridgefield and Weston, which is. I said, because the numbers aren't there. I mean, to really run this, I mean, 2 people a week, what they're doing is they're pulling other employees from different roles at Silver Hill to handle this. And yes, it's 48 hours, ideally 24, ideally 7 days a week, whatever. So we're just, I think at a point where this is still plateaued, we're into the 2nd year. The numbers are not really impressive. It's not growing. And if it's a healthy community, that's fine. But the other thing is the Easter, and I mentioned this before, they're one of many providers. And when some of the providers are too busy, and that's why there's this overflow thing, but once they have competition, they're not gonna be as busy, and they're gonna be also threatened, maybe too strong a word, but they will open their services. I mean, plus, Stanford Hospital, their whole behavioral health thing is growing, Norwalk's is, so they're gonna be competitive players in it.
I also remember talking to Gerber years ago when he first arrived, that one of the, I watched him on a national Zoom, talk about how mental health diagnostics is not medical health diagnostics. It sometimes takes 6 to 8 months to get a viable treatment diagnostic out of this. And so I'm thinking, the urgent assessment is a wonderful concept, but I wonder how many of these people should be followed up and
Right, time reveals it's not a one-time, sometimes it is, it's a one-time visit, with diagnosis,
Yeah.
but other times it's gotta be keys.
well, anxiety and depression is such an easy one, so to speak, but.
That is my report. I am gonna pass around the holiday secret gift basket. If you all want to sign up, the date, December 18th, Monday, between 8:30 and 2:30. If you want to come by, and pick up 2 baskets and deliver, put your name down and Marcy will be in touch with you. And the baskets are coming in. It's so wonderful. Families
How
love
many
it.
recipients do we have?
30.
Okay, that's great.
That was fun, we did that last year, that was
25
very rewarding. Sometimes it takes like Meals on Wheels, you have to spend a little time, in it, but it's home, right? And then the budget.
So,
Yeah.
If they're home, sometimes, like months.
Yeah, just sometimes, sometimes they don't even know what we're
I think they were threatened to open the door once they.
Right, and sometimes, right, so this is, it is a secret. We don't want to
Yeah,
put them off guard or embarrass them.
Right.
So it is, it's just a little, not gonna do anything.
Next item, old business, the opioid settlement, Bethany touched on it. So she and I met with Tony Sullivan, who was actually a co-founder of Real, and spoke with him at length. There was another meeting involving the town lawyer and Todd Lanford, Bethany, Buck Murphy, and myself, because there's so many legal issues with this. They initially wanted the town logo to be part of their deal, and everyone backed away from that, including Rutland. It just was not a good arrangement, just because of legality, liability, et cetera. The way it stands now, Bethany to be patient or client will call Bethany, they'll be given a QR code, and they tap in, they sign into Real themselves. So it removes a lot of the liability, et cetera. And this was somewhat of an eye opener to me. I was aware that this was for parent education, but I also thought for patients themselves, that they were ever age, that they could access and they could almost provide therapy online. That's not the case. So it's just advisory, educating parents about what to do. So that also removes a lot of the liability. So I think it's all a go now. The money is there. Jimmy, was this a Janssen settlement? You know?
I don't
No, okay. Because at the time of the meeting, there was also all the news about the Sackler family and Purdue and Paul Sitz. And so I'm saying if they're, if we're relying on that 80 grand or whatever coming from this batch, it may not be happening or it may not be happening.
Yeah, I thought that was a done deal, that part.
I think the opioid, where we found 80, I don't know where it's coming from, but I think it is done. They're acting like it's not, so anyway, that's all good. So that's real. And
Well, that-
but it looks like
Well, the town already has that money, right?
Correct.
the town has the money.
Yeah. Okay.
Yeah, so what
Check
we,
is in the bank?
what we would do going forward, we
Clear.
talked about 6 months a year.
Yeah, I believe.
And then when we have 18,000, it's $6 grand a year, so let's do 3 years, but you can't do it like that. The town can only sign up a year at a time, so they will be, so real will be in existence and functioning for a year. New business, well, we're downtown, Jill's not hearing about things with them, so holiday gift distribution, we've got that set. Okay, that's great. HHS commission terms. Deanna Carlson is going to be calling you if she hasn't already, just to talk about interest going forward, staying on the commission, not. There are 3 people's terms coming to an end at this point in time. Alyssa, Alicia, myself, and then there was a little hiatus with Russ, Jim, Tom, and Peter.
I'm good.
Yeah. We only have 4.
It wasn't really formalized, and there were some reasons for that. Kevin wanted to make some changes.
Right.
So it got kind of pushed out, and then the primaries came, it got pushed out, and then the election came, and it got pushed out, although at the end he was still making some suggestions. But it was really,
Is Deanna calling all the commission members across the board or just this commission?
I think those people, maybe everyone.
A lot of
But I
fun.
know at least those terms,
But
as of last year and this year.
term limits they're not really limits, are there any people?
Well, it's 3 years, you sign up.
I know, but I mean.
It's
not
a
renew?
bit variable. You can exit or you.
Yeah, okay. I don't want to lose all this.
And what is the hiatus? What is that? What is the?
Just a little, like a little hole in the process.
Okay.
So like their term came up and they
Didn't give them
did it officially?
It's the selectmen that approve someone's moving to the next town.
Gotcha.
So they had to go through the process. So it was her selectmen, got to be okay with the other selectmen. And it just didn't happen in a timely fashion.
And then you, Alyssa, and I are officially up this December. Okay.
You could demand a raise.
Like I said,
maybe really.
Raise.
Good luck.
They're in negotiations right now, let's just say. We're negotiating.
Yeah.
okay, calendar, did you all get the calendar with the minutes or? Yes. Any questions about the calendar? May I have a motion to approve the calendar as is? I see where there was no meeting scheduled for July or August. Anyone disappointed with that?
Oh, no darn.
All in favor of the calendar, there's aye. Any opposed? Okay, so thank you.
I'm sure you will just. Great meeting, well done.
Yeah.
Jill,
On time.
perfect timing.
It's only 9:27.
And this is Jill Winter, with Family Center, Second for Hope, and we just wanted to, have her give us a little, speaking about the mental health providers, and what they do for us in the town.
Nice to meet you. Thanks for coming. I'm here so the first time for the record, I'm the chair of Health and Human Services. I usually skip by that. Also, it's great to have you here. So Center for Hope is what we used way back when, and that was the name. And then in 2005, Center for Hope aligned with Family Centers. So you can take it from there about your.
Yes, hi everyone, thank you for having me, my name is Jill Winter, as Bethany said, I am the Senior Director of Behavioral Health Family Centers. I've actually been with Family Centers just over a year, so if any of you guys have history about the relationship and programming that I probably may not even know. But we do have a lot of programs at family centers. I'll speak to a couple of programs that are probably most relevant to this community. And I'm happy to get more brochures or share whatever else is needed if you want more information. So I guess very briefly, we have an outpatient medical center in Greenwich, and we have dental services. So we have a lot of clients in the community who come to us for those services. We also have outpatient behavioral health program. We have one in Darien, which would be the closest location to this community. We have one in Stanford in the Commerce Hill area and one in Greenwich. And then in addition to that programming, we also have some school-based health centers. They are concentrated in Stanford, although we have one in Greenwich as well. And that is accessible for the kids that are in the school that either need mental health, dental, or behavioral health services. So in terms of our location and some of the programming that happens out of our Darien location, it's the clients who come to us either in person, and we do have some clients from New Canaan. It's not a huge number, but we have clients coming to us in person for mental health services. You know, they have an intake with a clinician. It's usually the clinician that they are going to be working with. That's the ideal. And then we provide individual therapy, which is usually weekly, parenting work, family work. We see children, we see adults. We really work with people that are able to be maintained in the community, somebody who is maybe higher risk, higher need, in and out of the hospital, someone who may need more than once a week, 45-minute therapy is probably not right for us. There's more, more specialized programs, but somebody who's coming in for depression, anxiety, adjustment disorder, family issues, work stress, etc., would be appropriate for us. And we bill to insurance, but we also have a private pay option. And if a client, because of their financial situation, is not able to pay full fee, we do require paperwork, but we do have a sliding scale, and it does go quite well if the financial documents were.
Can you give an example of how that sliding scale would work for somebody who needed weekly sessions for a stretch of time?
So there's an application. We do require their W-2 from the year before, and we do require if they're working some pay stubs. If they're not working, they could attest to that. We do look at, are they getting SSI, SSD, unemployment, etc. And then we do have a sliding scale where maybe they made $25,000, I'm totally making this up, but $25,000 a year. There's 5 people in their household. That would put them, at $35 per session, and then they are entered into our system. So every time they have a behavioral health session, they are billed for $35.
And what would be the full rate for somebody with more research?
Full rate for a therapy session is about 160, but we do go quite low.
And a question on the insurance side. Most insurance companies do good work on that physical health, but not on mental. I'm wondering what the percent of insurance providers that you work with are covering mental health.
So nowadays, they all seem to cover mental health, but not at 100%. So if a client, a lot of this is really up to the client's individual, insurance contract that they have at their own place of employment. So it does vary. So some clients come in and they have, I remember starting to do this 20 plus years ago, right? And you have to beg for, this client really needs 10 therapy sessions, and this is why. And then if you needed more, you had to beg for more. We are fortunately not in that place anymore. Most insurance plans, not all, again, it depends on employment contracts for insurance, do cover mental health. But if the client may have a $20 copay or $10 copay or a $50 copay, or which we cannot waive for our insurance contracts and our agreements, but somebody may come in and have a $12,000 deductible, which is really high, then they would be paying $150, $160, whatever it is, depending on session type, per session until they meet their deductible. And then it gets very confusing, I'm sure you guys. Based on, they
Sure,
may then meet their deductible and then their insurance says, okay, you don't have to pay anything for the rest of the year, but some insurances say, oh, you have a $3 co-insurance. So it's based on what the insurance.
Are there any
Mandate
particular
thing.
national insurance carrier models that you would recommend that seem to be doing it right? Which is relative.
That's hard to say. I mean,
You could say no.
insurances, their agenda is about making money, not necessarily, serving people in need and not, at cost. So I think it's very challenging.
You had mentioned that a small percentage of people originating from New Canaan. Do you have an idea of what that is and how many of them maybe came through our urgent assessment system with Silver Hill as a referral?
So I don't, but I'd be happy to take a look at that in
Okay.
terms of people that we serve in New Canaan. We don't get, to my knowledge, we really have not gotten too many calls
Okay,
through the urgent care
Okay.
process, which I understand is somewhat newer, right?
It's about a year and a half.
Yeah,
Yeah, they refer primarily to individual physicians.
for therapy,
Or, individual providers.
Yeah.
It's psychiatrists, psychologists. And clinical
Yeah.
social-
yeah, but I was just looking at, from a sliding scale standpoint, there may be some families that may not be able to refer to
Yeah.
a primary physician and, $35 may be a
Yeah,
reasonable.
but they are aware of family centers.
Yeah.
Which is good. Where, do you know where your majority is coming from, the schools or, community outreach? I mean, do you know where people come in?
yeah, I mean, we do track that. I think because we have our locations right in Stanford, Greenwich and Darien, we do pull a lot from those communities. I don't know how realistic it is for somebody to come from New Canaan and maybe get to Greenwich. I mean, on a weekly basis, Stanford's a little easier, Darien, I mean, I Googled it.
That's okay.
17 minutes, that is pretty realistic. I mean, now we are doing a lot of telehealth, so that offers a lot of flexibility. I do think we're definitely seeing an increase in, most of our callers at the moment want to come and be seen in person. I will say then they come in and are like, whoa, now that I met you, let's do telehealth. So we are able to offer that flexibility as long as it's clinically appropriate. We don't, and we get referrals from schools, from pediatricians, from word of mouth, from community-based programs. Since I'm newer to family centers in Connecticut, I'm not that familiar with what kind of resources are maybe more local that are getting more referrals outside of maybe individual providers, but we're certainly open to taking referrals from clients that are able to come to us or can be consistent.
When you mentioned telehealth, I saw Jim's ears kind of.
We do have psychiatry. We have a wonderful bilingual psychiatrist, and we also have a psychiatric nurse prescriber as well. So we are pretty well staffed. So for our clients, adults and children, but the client has to be in therapy with us in order to access medication. They can't just want a prescription.
Are you, at capacity? Are you still looking for more patients, or are you, looking for more people to treat the patients? Where are you on that spectrum?
Excellent question. We do have a wait list. We are looking, we're always looking to hire more staff, so it's not that we are not, open to that. We do want to add more staff to be able to meet the need. Recruitment, and this isn't just for family centers, it's a challenge. We're competing with a lot of the private telehealth companies where everyone gets to work from home 100%, and they pay much more. So recruitment is a challenge, but we are constantly looking to recruit to meet the need. In terms of access, clients that are able to come in during the day or do telehealth during the day, we are able to get in pretty quickly. A client who may, you know, my schedule only allows me to come in for an appointment or telehealth for an appointment at 6 o'clock on Monday, and that's it, that's gonna be tough. So the more flexibility somebody can come to us with. And I think telehealth allows a lot of that, right? Because you could go into it, not everyone can, but a private office at work during lunch or during a break, and you don't have to worry about adding a 40-minute commute, 20 minutes each way.
Are you a clinician by background?
I am, I'm a social worker. Yeah. That was somewhere, yes. Not like Russ. Yeah, most of our staff are licensed social workers, right? We have a couple of mental health counselors, and we have a marriage and family as well. And
I have a question, your Center for Hope,
yes,
in Darien, it's right on the Post Road, it's very easy.
yes,
Okay.
yes.
How, I know you, Family Centers and Center for Hope merged, right? Were they all?
Yes.
How many years ago? Or can you explain a little bit where it's at now? So it's
Yeah.
Center for Hope just for.
Zero.
bereavement?
2000.
Yeah,
To the-
sometimes, yeah.
Okay, so is
Yes.
it just for bereavement, or are you putting that more into Family Centers with behavioral health weekly?
Center for Hope
So-
for years, and I was very helpful with grief.
Yes,
and
Yeah.
Continued, and then
Okay.
the suicide issues, ideation, et
Yeah.
cetera. Very helpful, and that's what lots of New Canaan people went there for the.
yeah.
service.
So we have our Center for Hope is the name of our Darien location.
Okay.
And there are a couple of programs that come out of there. One is we have our outpatient mental health clinic, very similar, the same, just a different location than, you know, what we have in Stamford and Greenwich. But then we also have, the den for grieving kids. And there's two components to that program. One, programming is twice a month, one in person and one remote for families where there has been a significant loss. So usually a spouse, a parent. Families come together for in person, it's a communal dinner, and then they break up into groups. So we can see from a family, the husband who lost the wife would be in a spousal loss group, and then the kids would go in, depending on their age, they're broken up by age, parent loss group, and they meet for an hour, they do activities. There's some discussion, it depends on the age, and then, you know, it's a really wonderful program. People find that they get a lot of support that way. So families come to that. So, you know, we get calls sometimes for somebody who lost their spouse and their kids are older or out of state, whatever it is, that would not be the right programming for them. And then we have two other groups, which I'll mention in a second. So we do get New Canaan families for that program. The in-person meets in our Arch Street location in Greenwich. So they would be able to travel there. I would have to be able to travel there, but it also meets once a month remotely. So, you know, ideally somebody or a family is showing up to both options, but we do have some families because the distance may only be in our remote programming once a month. And then we also do school-based den groups. So we work with schools where there's a number of kids who have had a significant loss. And we have facilitators who are usually volunteers, sometimes they're interns, they are all trained, who will go into the school once a week for, 12 weeks at a time, and we'll pull the kids, meet with them, have a similar type of group around loss and bereavement. And then we do have two other groups that right now are going on remote. One is a suicide loss group. So clients can call, people can call, withdrawals can call, and if they have had some sort of loss due to suicide, it could be a close friend, a family member, they meet once a week. And then we also have a spousal loss group for people, obviously they've lost a spouse, but they tend to not be families where kids are also needing that type of support because the kids are out of the house and maybe there weren't kids, and we have once a week group for them. So the den programming, the evening den that I mentioned and school-based, There's no cost for that. That is funded by like donors and contributions, et cetera. For the 2 remote groups I mentioned, the groups are $40 a week for those.
School-based is only, Stanford and Rensselaer.
Most of our groups are in Stanford, they're in Norwalk, we are certainly open to, being in New Canaan schools, as well. We just haven't had those calls.
I mean, we do have kids in crisis positioned at the high school, and middle school.
So it's not a crisis, it is loss and bereavement groups, so it wouldn't be somebody who, yes, they might have had a loss, but now they're unstable and they maybe need extra support or a partial program, et cetera. That would not be the right person at that moment for the group. But somebody who is more stable, would have a significant loss, it allows them to come together. So see other kids, get the support, do some processing, maybe learn some coping skills when they are overwhelmed, et cetera.
Susan Bliss is the head of children's group, specialties services for children at in the Board of Ed. I'm gonna ask her if there's a need.
Yeah, she's welcome to call me, we can talk and, yeah, I mean, we usually need, the school really needs 4 people who are
To make it effective.
to make, well, yeah, because, you know, we have 2 people come out and want a group, exactly, we're getting that. But there, I mean, there's no cost for that, I mean, the parents have to be aware and sort of give permission, but we try to make, you know, barriers to treatment as little as
Okay.
possible, like, there's not a whole registration packet, they don't need to give insurance, they just need to agree with the school
Yeah.
involved. Yeah, no, absolutely, I'm happy to talk to anyone, and then let me just mention, we also have a trauma response team, where I know a few years ago, predates me, there was some work that we did in the New Canaan community. So usually that's after, a community crisis situation or loss, where we can, go in and talk to staff or parents, families, do a debriefing, and then also offer like one-on-one support in that, well, it's not ongoing, but in that moment. So we've been involved when there's been, you know, untimely deaths, suicide, accidents, going into communities, and I know we've been involved, I think in
Yeah.
Canyon a bunch of years ago. I will also mention, I believe, and I'm sorry, not quite clear on the history of this, I believe at some point, we might have started right before COVID, we had a clinician who was doing, a group in New Canaan once a week for people who have gone through recent divorces.
Yes, Jackie DeLuey was working with
Yeah.
someone there, yeah, because we heard there was a need. And you definitely stepped up to the plate, but it's interesting, once again, people saying they need, they want, and then supplying it, they don't come.
Yeah.
Yeah, but you guys are great, yeah.
And, you know, I mean, I'll be honest, I wasn't here for that. I don't know necessarily that it was marketed from us, like the right way, right? Like, I don't know, maybe like changing family status for adults may draw in more people than calling it a divorce group. I don't know.
Yeah,
But I'm not, you know, I wasn't here, so I'm not clear what the average is. But, you know, we're certainly open to
they're so open.
having those partnerships, having that conversation, seeing what we can do.
No, we're so grateful for you being in the community.
Absolutely. Thank you for the services that you
Yeah.
provide. I think this goes to a bigger picture as we look at the, I consider it a flow chart, but exactly input, output, and monitoring outcomes and who's in the network and who's out, and, you know, what resources I think.
Yeah, so
that'd be
family
perfect.
centers is great. Family centers, they're on our, post action crisis team in the event there is somebody that's post that, we have, yeah, they're definitely included in every aspect of when we need to come together, and find out, you know, what's best for the community and the services that can be offered, and yeah, you're always right in there.
Yeah, and I believe, I don't know if it's quarterly, there's a New Canaan, like a provider meeting with Susanna from Silver Hill.
Yeah, New Canaan Behavioral Health.
Yeah.
Wellness. Yeah, and you're always there too.
Yeah, I mean,
It's so important, and
yeah, we had some turnover, so Julian Green was our director of
Yes.
grief and trauma. So I know she used to attend them, and now I'm on the mailing list, so I hope to go to one.
Did she leave?
She did.
Do you interact with, or just work in parallel with like child guidance?
We had 10 meetings with them, and we, yeah. I mean, it's a different agency, but we do have like community task force, and I imagine they're probably at postvention, and, you know, I know Georgette and some of the team over there, so we do collaborate and communicate, and we have some committees we are co-chairing together.
All right, this has been
Thank
very.
This was very informative.
Yeah, this is, it's a face with a community agency.
Appreciate what you do.
Yeah.
Absolutely, thank you, and, you know, Bethany has all my contact information, I'm happy to talk to people individually, or if there are like community providers or resources or organizations you think it'd be helpful for me to talk to, or this like help program directly, so yes, I'm happy to do that.
Yeah, I think that's good.
Yeah.
Thank you.
Okay, thank you for understanding. Thank you.
Yes. It'd be nice to sit down and, you know, either the Community Foundation and with Jen and Bethany, just to get a sense of the flow, right? And the outcomes and who's going where. I think it would help us understand the resources that we need to come up with in terms of grants to help our community. But
Yeah, everybody's dealing with the same issues and, you know, attendance and, you know.
it's always been
cost of
fragmented.
resources.
It's always been fragmented. So now we have kind of an entry point and can see where the referrals are going and outcomes that are.
Yeah, small,
One of those, there's a big budget.
huge operation.
Well, believe it or not, I think we're setting a record here.
We're gonna be done?
I have not even done it.
It's holidays. We get out, do your shopping a little early.
Oh, good.
Um, Yeah, happy holidays and holidays. And we, anything you want to add? That is. Coming to an end. Don't have a motion to adjourn.
See you
Rush, we got a-
Well, I'm great at it. I motion and seconded in the same breath. I'm just hoping, given what you said before, that we get to see all of you in the new year. So I make a motion to adjourn and second it.
All in favor?
Okay, I'm going to end. Oh dear, we are having a holidays, everybody. It was all.
Great meeting, as always.